Good afternoon again, Madam Chair and members of the Health Committee, Delegate Lily Chi here to present HB 1126, Health Insurance and Managed Care Organizations related to lab services. Maryland is a global leader in biomedical innovation and life sciences, but our advances in health sciences and technologies often fail to translate into higher quality patient care for Marylanders due to our policy failures. One such example is the inability of Maryland's independent laboratories to offer innovative, timely, cost-effective, and personalized testing and diagnosis to patients. The reason is barriers to entry that prevent them from participating in current insurance networks and managed care organizations, or MCOs, that funnel patients to larger national labs that specialize in high-volume routine testing. Even though Maryland has about 500 independent labs, many patients, including roughly 1.5 million Medicaid enrollees, are limited to a few large national labs or the basic tests offered by MCO's own labs. House Bill 1126 provides a simple, practical solution. It prevents an insurance carrier from denying a lab from participating as a contract provider if the lab agrees to meet the terms and conditions under the health benefit plan. It also allows patients to use a lab of their choosing, as long as the lab participates as a contract provider in the insurer's carrier health benefit plan. By leveling the playing field, HB 1126 ensures that licensed and qualified local labs that meet the same standards and payment rules have equal opportunities to serve our patients in Maryland. This will improve patient access, promote competition, and encourage innovation, just like states like Tennessee, New Jersey, and Virginia have successfully done. They have shown that it is possible to expand patient access to quality care while maintaining robust oversight and high standards. I want to give a shout out to Dr. Sherry Dadger here for her leadership in organizing the independent labs to advocate on this issue. Independent labs are not only innovation drivers, but also our local small businesses. We should do everything we can to keep them in our state and help them grow and compete with national labs so they can make meaningful contributions to our community's quality of life, our innovation economy, and our ecosystem. With that, I will turn to my panel.
Thank you so much, Delegate Chief. Good afternoon, Chair Bagnall, Vice Chair Collison, and member of committee. My name is Sherry Dadgar. I'm an NIH board-certified molecular geneticist and founder of Precision Medicine Care, a clinical laboratory in Germantown dedicated to advancing precision medicine and publicly praised by Maryland government several times. This bill comes down to one simple question. Should access to medically necessary testing depend on the type of insurance card a patient carries? The answer must be no. A well-resourced patient with a private PPO insurance plan can access specialized laboratory testing, while a patient on Medicare or with a HMO cannot. Instead, they are limited to a small number of large corporate laboratories that may not offer specialized tests that local innovative laboratories provide. This bill allows patients to access timely, high-quality in-state laboratory services. Maryland has more than 500 qualified laboratories that 1.5 million Medicaid enrollees cannot access. Consider a patient with their pneumonia. A local lab can perform rapid molecular testing to identify the exact pathogen and guide treatment faster than sending samples out of state. Faster diagnosis allows provider to begin targeted therapy immediately instead of guessing and trying multiple medications. This applies to cancer, rare disease, and other complex conditions. Early accurate diagnosis reduces complications, hospitalization, and cost. Local laboratories are also playing a critical role in responding to public health emergencies. This bill does not change reimbursement rate, copay, deductible, or physician ordering protocol. It requires laboratories to accept existing contract terms. According to JAMA, increased competition among laboratories is decreasing costs rather than raising them. States such as Tennessee and Virginia had a successful model, and why not Maryland? For those reasons, I urge the committee to favor the bill. Thank you so much.
Good afternoon, Madam Chair, members of the committee. My name is Drew Vetter. I'm here on behalf of Precision Medicine Care. The heart of this issue is recognizing the important role that independent laboratories can play in our healthcare system and in our local economy. Compared to larger providers, independent labs can provide personalized service, rapid turnaround times, and flexibility in specialized testing. Network restrictions and exclusive contracting arrangements are not new. What is new is the rapid pace of innovation that advanced testing by independent laboratories can do. This bill ensures that more Marylanders can access these local lab services and potentially identify and treat life-threatening diseases earlier. Currently, some of these specialized tests go out of state. This bill would ensure that testing can be done here locally. Doing so can also increase competition, which can drive innovation and decrease costs. This bill also helps to support and expand the independent local laboratory industry, which in Maryland is already 500 companies strong with 8,000 employees and $1.9 billion in economic impact. When the state of Tennessee passed a similar law in 2023, they've experienced a 103% increase in the number of local independent labs. This bill benefits Maryland patients and ensures that this important industry stays in Maryland rather than leaving for our competitor states. For these reasons, we urge a favorable report. Thank you.
Good afternoon, Madam Chair Bagnall and committee members. My name is Precious McCowan. I am a kidney transplant patient. I'm also a donor mom and an advocate for individuals living with kidney disease. And I'm here today asking for your support for House Bill 1126. At the age of 9, I was diagnosed with type 1 diabetes. During that time, my kidneys began to fail. So I did in-center hemodialysis for a number of years. I've had a total of 3 kidney transplants, various hospitalizations, and on and off of dialysis. I am here today asking you to please support this bill. My journey began in 2010, where I received both a kidney and pancreas transplant. Both organs failed unexpectedly. That is not the hardest part of my journey. The hardest part is that my 2-year-old son passed away unexpectedly, and my husband and I decided to donate his organs to be a blessing to others. During that time, after making funeral arrangements, I was rushed into emergency surgery due to transplanted kidney and pancreas complications. I always wondered, what if my care team, my provider, myself, or my insurance would cover non-invasive tests that could have helped my doctors to understand the signs of rejection early on. And I also remember, what if during that time I was well and I could have attended my son's services? Due to that surgery, I couldn't attend his funeral. There are so many of us out here today, patients like me. We have been given the gift of life, and so I ask you today to please support this bill. Thank you so much for your time.
Thank you for your testimony. And I do have Kelly Schultz also on your panel. And thank you for sharing your very personal story.
Good afternoon, Madam Chair, members of the committee. For the record, my name is Kelly Schultz, and I am the CEO of the Maryland Tech Council. I really want to thank Delegate Chi for taking on this particular bill. Thank you so much for your sponsorship. And also thank you to Ms. Dagger for she's a great member of the Maryland Tech Council, by the way, and very supportive of the work that she and her team has been doing and flourishing throughout the state of Maryland. Passage of this bill would further strengthen Maryland's already robust life sciences and biotechnology ecosystem. Independent and specialized laboratories are a critical part of this ecosystem. They are often small and mid-sized Maryland-based businesses that employ highly skilled workers and contribute significantly to our state's economy. Many of these companies are developing advanced diagnostic technologies that improve the detection, monitoring, and treatment of diseases. God bless you. However, when qualified laboratories face barriers to participating in healthcare networks, it can limit these innovative companies' opportunities to scale their technologies and deliver new solutions to patients and providers. HB 1126 helps level the playing field by ensuring that qualified laboratories are not excluded simply due to contracting limitations, allowing more Maryland-based companies to compete and to grow. The economic impact is clear. This supports high-quality, high-wage jobs in life science sector, encourages investment and expansion of diagnostic and biotech companies in Maryland, and strengthens our state's position as a national leader in innovation and precision medicine. This bill also helps to ensure that innovation developed here in Maryland can actually reach Maryland patients rather than being sidelined by restrictive networking policies. For all of these reasons, Madam Chair, we support and encourage the committee support of House Bill 1126.
Thank you for your testimony. Are there any questions for this panel from the members? Seeing none. Sorry, Delegate Hutchins.
Thank you, Madam Chair. Perhaps not Delegate Chi, but you can tell whoever wants to answer the question. I'm fascinated by this bill because it is innovation. We have Kelly here supporting the innovation that it brings to the state. Give me a preamble of what the opposition is going to say about the bill.
They will say they need some consistency and the economy of scale and the cost, because we all know there is a lot of vertical integration in some managed care organizations, right, in order to control the whole system. That's actually not to the benefits of the patients. We believe competition actually drives innovation and lowers the cost and gives the patients more timely options that could have saved the, potentially alive, as Ms. McCone testified. Right? She almost lost her life because of late detection.
Thank you. Thank you, Madam Chair.
Are there any more questions from Delegate Taveras?
I'll be quick. So let me make sure I understand. So because the current contracted labs are limited in what they can do, certain things didn't get done. So what are the kind of tests that maybe your lab would provide that are currently lacking in the marketplace?
Absolutely. My lab is a precision medicine lab. We have about more than 500 diagnostic tools that many of them are novel and not easily accessible through the large corporate laboratories that are located outside of the state. Managed care organizations are contracted exclusively with a few large corporate laboratories outside of the state. They may or may not offer some of these tests, but obviously there are some of the tests that are not available in the market. What they do, let's say it's a cancer patient that does need to go under genetic testing for the guided therapy. They are basically sending and resourcing them out to the laboratories that are in other states again. So those large corporate also have like other arrangements with the out-of-state laboratories, and those samples goes out of the state. So to answer your question more precisely, these are all highly complex and novel and innovative tests that many of the independent laboratories in the state are developing. Some of them might be accessible through a third-party arrangement, and some may not. And it is really important to make this accessible at the local state for the patient, because obviously outsourcing the samples out of the state is associated with the delay in diagnosis, which itself there are lies of series of evidences that shows that the delay in diagnosis is directly increasing costs for healthcare. And I'll be more than happy to provide references for the committee. if needed.
Thank you very much. Seeing no further questions for this panel, we'll bring the next panel up. It's Andrew Diamond, Gina Mates, Prabhu Salvam, and Joseph Chow. Drew Vedder and Andrew Zirkle, if you want to stand by.
Good afternoon, Chair Bagnall and members of the committee. My name is Andrew Diamond. I am the Chief Executive Officer of Diamond Medical Laboratories, a Maryland-based clinical laboratory that specializes in serving patients in post-acute care settings. Every day, our laboratory processes approximately 2,400 diagnostic tests that physicians rely on to care for vulnerable patients across Maryland. Many of these patients are elderly, medically fragile, and living in skilled nursing facilities, assisted living communities, or receiving care at home because they cannot easily travel to a traditional medical setting. These individuals are among the most vulnerable patients in our healthcare system. Many live with multiple chronic illnesses, weakened immune systems, and complex medical regimens. When their conditions change, physicians depend on timely diagnostic testing to determine what is happening and how to treat them. In these situations, time truly matters. Our laboratory is designed to provide same-day diagnostic results whenever possible, allowing physicians and care teams to intervene quickly. When doctors receive results on time, they can often treat patients safely where they live and prevent a manageable condition from becoming a medical emergency. But when insurance networks restrict access to qualified laboratories like ours, physicians may be forced to use laboratories that are not structured to support these vulnerable populations. This can delay results and delay care. For laboratories like ours that specialize in serving post-acute and homebound patients, fair participation in health plan networks is essential to our ability to operate and continue serving these communities. Without the ability to participate fairly, local laboratories that provide rapid and specialized services for vulnerable patients may struggle to sustain these services. House Bill 1126 helps address this challenge. The bill does not require insurers to use any particular laboratory. It simply ensures that qualified laboratories that meet health plan standards have the fair opportunity to participate, allowing physicians to access the laboratories best equipped to support their patients. For the vulnerable populations we serve, timely diagnostic testing is not just about convenience, it's about essential to protecting their health and independence. For these reasons, I respectfully urge the committee to issue a favorable report on House Bill 1126. Thank you for your consideration.
Good job.
Hello. Dear Chair and Bagnall and members of the committee, thank you for having me today. My name is Gina Mattis, and I'm the former CEO and founder of Principal Diagnostics. Our laboratory has been operating and supporting physicians and patients across Maryland for more than a decade. I'm also a resident of Frederick, Maryland. I'm writing to express strong support for House Bill 1126, which helps ensure fair network access for qualified laboratories. Over the past decade, our laboratory has worked closely with healthcare providers throughout Maryland to deliver advanced diagnostic testing that supports patient care and medical decision-making. Independent laboratories like ours often provide specialized diagnostics that are critical for physician managing complex patient populations, including behavioral health patients, infectious disease cases, and individuals with rare hereditary conditions. These advanced tests help clinicians diagnose conditions earlier, select appropriate therapies, and monitor patient outcomes more effectively. Despite meeting rigorous federal and state regulatory standards, independent laboratories often face significant barriers to participating in insurance networks. In many cases, networks remain closed even when laboratories are willing to meet the same credentialing, quality, and reimbursement terms already accepted by the participating laboratories. Many times, people will ask us if we can do different types of testing, and we have to refer them and say that we're not able to do that. So House Bill 1126 addresses this issue in a balanced and practical way. This bill does not require insurers to accept laboratories that fail to meet the standards. Instead, it ensures that laboratories are willing to comply with the same contractual terms, including reimbursement rates, quality requirements, are not to exclude the participation solely due to market leverage or network exclusivity. Thank you very much for your time. Yep.
Thank you, Chair Bagnall, Vice Chair Cullison, and members of the Health Committee. As an ER physician, I see patients when the system has already failed them. Missed infections, delayed cancer diagnoses, and preventable complications. Every healthcare provider relies on 3 pillars to care for a patient. The first, the patient encounter, 2, laboratory testing, and 3, the medications used to treat disease. Maryland addressed one of those pillars decades ago under the Maryland Insurance Code, Section 15806, titled Choice of Pharmacy. Because of this, patients have the right to choose where they fill prescriptions. But the laboratory testing pillar remains unprotected. Independent labs are often local small businesses, as you've heard, and they frequently provide higher quality, more precise care at a fraction of the cost, sometimes 1/3 of what hospital-based labs charge. Yet insurance carriers routinely restrict access to them. Instead, large national corporations dominate through exclusive contracts, sending jobs and revenue often out of state. And just like PBMs in pharmacy, laboratory benefit managers act as middlemen, limiting access, reducing competition, and contributing to delays in diagnosis, especially in underserved communities. With Medicaid cuts, loss of ACA subsidies, and so many now afraid to seek care outside of their communities, it's so critical for us to remove any barriers to healthcare access, including geographic barriers. In Montgomery County, where I'm running for county council at large, we also face stagnant private sector growth despite highly talented workers, and expanding healthcare access means greater innovation, entrepreneurship, and good-paying jobs while strengthening a sector that Maryland is already a national leader in. Please support HB 1126 to protect access, lower costs, and improve care for all Marylanders. Thank you. Prabhu Selvam.
I am not trying to be disrespectful, but we actually have to be back on the floor at 5:30, and I am going to have to start reducing the time. I'm trying not to do that. So please, if your testimony has already been stated, please amend your testimony.
Well, you call the right person, because I'm actually threw out my written one, and I'll just actually talk and respond appropriately, so hopefully I'll keep this short. So my name is Joseph Chow. I'm a physician and chief medical officer at Virant Diagnostics, a lab in Silver Spring, Maryland. And we specialize in rare diseases, allergy, and immunology testing. And at the heart of this bill, essentially, is credentialing. By actually opening up and partnering with independent labs, I think MCOs will actually improve their efficiencies in many, many ways, as well as actually streamline costs, as others have stated, which is basically through competition, potentially. And what this opens up, essentially, is actually choices ultimately benefiting the patient and their physicians. I'll give you some examples. We actually have 2 tests that we've developed over the past few years that are for rare diseases. For one, it actually affects 1 in 10,000 patients. We have the highest sensitivity tests throughout the United States, but yet we often get denied payment even after we perform the test because we're not in network with many of the MCOs. We have a second test that affects 1 in 50,000 patients. Very complicated. Both of these are very complicated tests and highly expensive to develop. And we're the only commercial lab in the United States to actually have this available. Yet, again, we get denied payment on this. And we're not talking about high-cost tests. This test, very complicated through mass specs, is only $125 by coding. And so we're not talking about expensive tests, but yet we're denied that because we're not in network. So in the end, I support this bill because it will open up access, better clinical decision-making, and management of patients that will benefit